There are two women who inspired me to be a nurse. First is my mother. She's a nurse. And every time she would come home and she'd tell us about her stories about her patients, and I used to ask her, are you happy with your work? Do you like it? And she said, yeah, absolutely, it's very rewarding. And I think you would like this line of work. I think this is for you.
I grew up with all nurses in my family. My mom was a nurse, and my aunt as well, and my uncle was a nurse, and my other aunt as well. So 2 aunts and an uncle were nurses. I was surrounded by it.
My family inspired me because I have a few nurses in my family. And my sister especially, she's a nurse herself, and she's always pushing me to become a nurse.
I worked as a nurse's aide in a nursing home through college and decided that I wanted something that would use my heart, my hands, and my head, and realized that nursing was that.
My most meaningful moment as a nurse, I think, is almost on a daily basis. Just seeing very ill patients eventually thrive, get well, and then go home. And just knowing that I had a hand in that, it's very rewarding at the end of the day.
I think that's important, that something that you did your whole life made a difference to somebody else. And even to this day, all these years later, every person that I take care of, I look at them as if they could be somebody in my family. And I treat them all exactly as if they were somebody in my family.
Montefiore has had a huge impact on my nursing career. I've been here nearly 18 years. There's been so much support from administration, colleagues, physicians that I've worked with, other nurses that mentored me, and it's been a nice path and journey since I started to where I am now, and I know probably won't end there.
I have been at Montefiore for 25 years, and I have been a staff nurse. I've been from a staff nurse to a patient care coordinator. I've been a bone marrow transplant coordinator. I've been an acting manager. I've been a manager. I've gone to school. I've had 2 masters through Montefiore. So I think Montefiore has done wonderful things for me, educationally and motivationally.
Recently I had a patient that I managed for about 3 years, and I would speak to her and her husband, and they were just lovely and just so willing to get any information to help them manage their illness. And the husband had called me up just to let me know how he was doing one day, and what was the nicest thing he said to me was that he knew that what I did was my job, but he felt like I did it more from my heart, and that he could really see that in the way that I interacted with him and his wife. And that just really meant a lot to me, because you don't want people to think that this is just a job. You know, most people who go into nursing, it's a calling, and they really feel it deep in their heart. So to have that recognized meant a lot to me.
I love being able to serve others. I love being able to use my skills and what I've been equipped with to help others. You know, mind you, nursing is a very challenging job, but there comes a point when at the end of the day, you're driving back home or you're sitting in your car and you just look upon all the things that happen throughout the course of the day, and you're just grateful for the family members that say, hey, thank you so much for listening, or thank you for getting me that extra blanket, or thank you for just holding my hand through that process. And it's just rewarding to make someone else happy and to be able to give to others.
I am happy that I chose to become a nurse. It has fulfilled all of my dreams and expectations. It is truly a career where I work with my hands, my heart, and my head.
I'm very, very happy that I'm a nurse, that I chose to be a nurse. This is where I belong. First and foremost, I'm a nurse, and I'll always be a nurse.